and welcome to another episode of the Dr. Kerr Review. My name is Dr. Alex Keller, and I'm here with my colleague, Dr. Holly Lucille. And today we're talking about antimicrobials. So, Holly, antimicrobials, we often think of antimicrobials synonymous with antibiotics, and the concept of antibiotic resistance, which has become quite a big issue.
Yeah, because of overuse of antibiotics in particular.
Right.
Right.
So why should we consider natural antimicrobials instead of synthetic antibiotics?
Yeah, for me, I think that if you look at an antibiotic, a synthetic antibiotic, it's going to target an or a bacteria infection. It's not going to do anything for fungus. It's not going to do anything for viral infections. Although I know plenty of folks in my practice who present to their primary care providers with a viral infection and will often get prescribed an antibiotic. And what you see with more natural antimicrobials is more broad spectrum effects. So antiviral, antifungal, antibacterial as well.
Exactly.
Antiparasitic even.
Yeah, right. So you obviously have a wider variety of targets that an antimicrobial from a natural source can target. What kind of conditions are we typically looking at when we're considering antimicrobials?
Well, let's just think about it this way. Like let's say I swabbed your pen that you've been using, right? And then you're probably going to touch your mouth or your eyes or your ears or something. And we put it on a petri dish. This stuff is going to grow. We live amongst viruses, bacteria, fungus, parasites, all around, but we've got this immune system, right? Boom, boom. That can be defense against getting infected. But when your immune system gets compromised, these normal flora, let's say, become opportunistic. They I can set up housekeeping in there. They grow, proliferate, and become pathogenic that way, or disease-causing. And so what I'm seeing a lot of SIBO, certainly, right? Other gut infections, I should say, small bowel and large bowel infections, simple colds and flu, viral infections,
All
absolutely.
those things, yeah,
Sure.
bladder infections, potentially UTIs,
Yes.
things like that. So we still need to consider various ingredients based on the infection that we're dealing with, right? So what are some of the ingredients that we can break out of a full topic like this?
So this is Candida forte. So I would say a synergistic combination formula specifically for fungus or candida. Yep. I think one of the highlights here, caprylic acid, fatty acid from coconut oil, really effective because it helps break down the cell wall. So we're able to get in there and actually kill that infection. So remove the antigen.
Absolutely, yeah. And I'll point out this one here from Metagenics called Candibactin BR.
Yep.
So high amount of berberine from Oregon grape specifically, but berberine is one of these broader antimicrobials that you can use in a variety of situations, often used in SIBO protocols as an antibiotic, but also often used in fungal protocols as an antifungal.
Very broad spectrum, incredible ingredient, berberine.
Yeah, and both of these products, again, they're a synergistic combination of a variety of ingredients so that you're getting different types of chemical reactions happening and not just one specific chemical.
Exactly, and to your point, definitely differs from synthetic antibiotics.
Yeah. Tell me about silver from Argentum.
Yeah, so Argentum 23, what I love about this hydrosol silver is the 23 parts per million, so very small, so the absorption is there, and that has been a problem in the past. And then silver has been used for thousands of years. For a very powerful antimicrobial. And you can take silver, it's a little bit lighter handed than some of the other big antimicrobials that we are going to talk about. And so it doesn't affect the microflora, our other gut flora, or the microbiome as much. And so I like it for that reason as well.
Right, yeah. Let's jump to oil of oregano. So we've got two products here, one from Biotics Research and one from DFH.
Yeah, so antiviral, antibacterial, antifungal, antiparasitic, absolutely incredible. You can take it in a capsule. You can also, if you're brave enough, there is liquid form as well. It's just very potent.
Yeah, very potent. Yeah. I can handle max one drop. Yeah. My wife always laughs at me because if I do anything more than that, I'm gagging and coughing.
But for pharyngitis or throat infections.
Absolutely effective.
Like that.
Yep.
Right on the spot there.
Usually one of the first go-tos when you're dealing with any kind of low-grade infection that's just starting to come.
Yeah.
So this liquid by Biobotanical Research, it's called Biocidin.
Yes.
This is a very well-known product that's now extremely commonly used. Why is it?
Because of its broad spectrum, and I think also the research that they're doing. I mean, and from a protocol perspective, the duration of use is longer, I think especially in SIBO cases, but effective, right? So one of the things I think with SIBO, killing it off, so location shouldn't have overgrowth in your small intestines at all. So getting rid of it, but not having it come back, really, really important. And Biocidin has been, in my clinical practice, a real weapon when it comes to treating SIBO effectively.
Yeah. So speaking of SIBO specifically, we've also got FC-Cytal by Biotics Research.
Right. So proprietary blend here, another sort of synergistic combination antimicrobial. But you mentioned some research, about comparing it to rifaximin.
Yeah, exactly. So there's actually a clinical study where they showed a greater effectiveness in terms of preventing recurrence using FC-Cytal instead of rifaximin for a SIBO-specific type of condition.
Yeah, that's great.
Pretty interesting when you see that a proprietary blend of different herbs can be directly compared to an antibiotic, and it's shown to be more effective.
Yeah, and so we're lucky that we have access to natural antimicrobials, more broad spectrum, I think can do the job better. And then you're always wanting to, think about increasing the resistance of the host. Who's the host? Whoever has the infection. They're hosting these little bugs and these opportunistic characters at this point in time. So making sure using something like abiotic, which is immune system support. So it does have some nice antimicrobials like garlic, but elderberry and other things to actually increase your own immune system.
Yeah, that's a perfect segue over is the combination of using an antimicrobial and an immune booster.
Right.
And one thing that we haven't talked about here is probiotics.
Right.
So when we talk about antibiotic resistance and the fact that we're using an excess amount of synthetic antibiotics and killing off the microflora, same thing could apply with natural antimicrobials, right? So generally speaking, whenever we use a protocol that's antimicrobial, you should typically be bringing in some probiotics as well.
Right.
Just not necessarily at the same time.
Yeah, and you've heard, whether there's 3, 4, 5, sometimes up to 7 R's when it comes to treatment in this way. R, number 1, remove the offending agent, the antigen. R, number 2, reinoculate with your good bacteria.
Yeah, something to keep in mind.
Yeah.
Okay, well, that's been another episode of the Dr. Curry Review. To find out more about these products and many more, visit naturalpartners.com or fullscript.com. And to learn more about the specific ingredients, you can also visit our medical education hub at fullscript.com/HCP. We'll see you next time.